still on COVID jabs, the World Health Organization has confirmed there is no evidence to suggest that vaccines are ineffective against the new Omicron variant. Our reporter Heidi Giokos has been following that briefing, which also looked at vaccine rollout across the African continent. She joins us now live with more details. So Heidi, the WHO earlier briefing the media, and it seems as though Omicron is only in 10 African countries so far.
Yes, indeed, Shahan. There was so much panic and pandemonium when the South African government, together with its surveillance team, said that there seems to be another variant due to how highly transmissible it is, and everybody was looking at South Africa and Southern Africa as though the variant emerged from here. But the World Health Organization making it very clear that it's very difficult to identify where a variant actually emerges from, and that countries like South Africa, Botswana, and neighboring countries should not be discriminated against or stigmatized because they have good surveillance and were able to pick this up. What's interesting here, though, Shahan, is that the Omicron variant has been identified in over 60 countries and only in 10 to 11 African countries. So the World Health Organization making it very clear to say that this variant has moved around globally, and sometimes travel bans don't actually provide the necessary kind of coverage or support that these countries are looking for because of how quickly variants spread. And a regulation and a travel ban doesn't always provide the protection that these countries actually look for, especially in travel bans. But what's interesting, Shahan, is that we must highlight the fact that the World Health Organization is trying to collate as much data as possible, especially from other countries that are doing surveillance when it comes to Omicron, and any kind of data that they have managed to gather, they provide it to the World Health Organization so they can also update and do their own surveillance. What's come through is the fact that there is no evidence to suggest that the current vaccines that are being administered are not effective against Omicron. What is coming through is that it's a lot milder this time around. And what's interesting here, Shahan, is that when Gauteng held its Coronavirus Command Council briefing, they actually did mention the fact that vaccines have worked against Beta, against Delta, and they are expecting it to possibly work against Omicron because the vaccines are made to try and fight off severe COVID-19 infection. But let's listen further to a doctor from the World Health Organization.
There is an assumption that the current vaccines may not protect people against Omicron. But so far, there is no conclusive evidence that vaccines are ineffective against this new variant. Vaccines have protected, as we know, people from severe disease and hospitalization due to the other variants of concern so far, and there's been no need to modify these vaccines. So encouragingly, emerging data from South Africa suggests that Omicron may cause less severe disease. Data which looked at hospitalization across the country between 14 November and 4th December found that ICU occupancy was only 6.3%, which is very low compared with the same period when South Africa was facing the peak, which was linked at that time to Delta variant, and I'm talking about July this year. So this is still a preliminary analysis, and we will need at least another 2 to 3 weeks to determine Omicron's full effects.
So Heidi, you're also looking at another story about the mRNA technology hub that's been established. What exactly is this going to do for vaccine manufacturing here in South Africa?
Shahan, I must say, today I was reminded why I studied journalism, because this is all just very scientific and very complicated. But basically, this was announced a while back regarding this mRNA technology hub. And what it all means, Shahan, is that South Africa specifically, will set up these hubs across the African continent to try and develop and manufacture mRNA vaccines. And what this actually means is you have, for example, Pfizer that is not willing to teach other countries like South Africa and the African continent what kind of technology is actually used in these COVID-19 vaccines that uses mRNA technology. So this hub is being established together with scientists, together with local company BioVac, to develop and manufacture these vaccines. It's not only going to be used for COVID-19 vaccines, but also for any kind of other vaccine that uses this kind of technology. At the African continent, and we know here in South Africa as well, Shahan, we were last in line to get the COVID-19 vaccines because we are less advantaged markets, and we weren't able to put our hands first on those COVID-19 vaccines. The African continent experienced very similar, and you saw that almost 99% of vaccines that are used on the African continent are imported. So this is why they're trying to change the game and trying to say, let's create our own technology hub. Let's try and develop and manufacture these vaccines here with these technology companies so that we will not have to go with a begging bowl to these manufacturers for these vaccines, especially during the middle of a pandemic when there's such a need for these vaccines. But let's listen to the Science and Technology for Innovation Minister, Deputy Minister Buti Manamela, that explains this further.
This is both the first facility of its kind and the first to be based on the African continent. Its purpose is to increase access to mRNA vaccines in low and middle income countries, especially in Africa, thus ensuring a sustainable vaccine supply for the current and future pandemics by establishing local manufacturing capacity using a technology transfer model. As part of its function, the South African hub will involve in end-to-end development of mRNA-based vaccines. It will serve as an mRNA vaccine training facility where technology is established at industrial scale and clinical development is performed. A training center will be established as well as a current goods manufacturing practice clinical trial production facility to support vaccine development. Commercial manufacture of an mRNA vaccine will be key both to meeting demand and to ensuring the sustainability of the technology transfer. To this end, full use will be made of South African technical expertise in genomics, immunology, vaccine manufacturing, and clinical trials, thus feeding the pipeline for local manufacturing.
Didn't know that the Deputy Minister had hair now.